When we talk about cardiovascular health, the conversation often centers on numbers, blood pressure, cholesterol, risk scores. Those numbers matter, but they are downstream data. They reflect how the cardiovascular system is responding to daily inputs. The heart does not function in isolation. It responds continuously to muscle activity, nutrient intake, sleep patterns, and nervous system signaling. Today, I want to talk through 4 inputs that meaningfully influence cardiovascular function and explain why they matter physiologically. This is not about doing everything at once. It is about understanding how small, repeatable actions send signals to the heart and blood vessels over time. Blood pressure is not determined solely by sodium intake or genetics. It is strongly influenced by vascular tone, how flexible or resistant blood vessels are, and how efficiently the body manages glucose and insulin. Skeletal muscles play a central role here. When muscles contract against resistance, they stimulate nitric oxide production. Nitric oxide allows blood vessels to dilate more effectively, reducing resistance. Resistance training also improves endothelial function and insulin sensitivity, which lowers metabolic stress on the vascular system. Over time, this combination can lower resting blood pressure and reduce cardiovascular strain. A common misconception is that strength training is only about building muscle mass or that it is unsafe for people with elevated blood pressure. When appropriately dosed, resistance training is protective. A small win looks like this: 10 to 15 minutes, 2 or 3 times per week, focused on large muscle groups, sit to stand movements, wall push ups, carrying moderate loads. Consistency matters more than intensity. Fiber is often discussed as a single nutrient, but physiologically, it functions in multiple ways that directly affect cardiovascular risk. Soluble fiber binds bile acids in the intestine. Because bile acids are made from cholesterol, this process reduces LDL cholesterol reabsorption. Soluble fiber also slows glucose absorption, reducing post-meal glucose spikes that stress blood vessels. Insoluble fiber supports gut motility and microbial diversity, which indirectly influences systemic inflammation, another contributor to cardiovascular disease. Most of us have been advised to eat more fiber without guidance on type or mechanism, which limits effectiveness. A small win is addition, not overhaul. One fiber-rich food per day is sufficient to begin shifting lipid and glucose dynamics. Oats, chia seeds, beans, lentils, vegetables observe satiation, energy stability, and digestive comfort rather than aiming for a perfect number. Sleep is not passive rest. It is an active recovery state for the cardiovascular system. When sleep is insufficient or irregular, sympathetic nervous system activity increases. Cortisol and catecholamines remain elevated. This raises resting heart rate, increases blood pressure, and promotes inflammation. Sleep deprivation also impairs glucose regulation, compounding vascular stress. Even modest chronic sleep loss can disrupt autonomic balance. A helpful reframe is this: sleep consistency often matters more than sleep perfection. A small win might be a consistent wake time, an earlier caffeine cutoff, or reducing screen exposure before bed. Even a 15 to 30-minute improvement can lower sympathetic tone and reduce cardiovascular load. Pay attention to physiological clues: morning heart rate, energy on waking, baseline mood, rather than idealized sleep metrics. The cardiovascular system is highly responsive to emotional and physiological stress through the autonomic nervous system. Chronic stress increases sympathetic activation, raising vascular tone and suppressing heart rate variability. Over time, this contributes to inflammation and sustained cardiac workload. Social isolation and unresolved stress are independently associated with higher cardiovascular risk. Connection and regulation are biological processes, not abstract concepts. A small win here is not eliminating stress, but improving recovery. One daily activity that supports nervous system regulation, like a brief conversation, a quiet walk, an intentional breathing session, can all help return systems towards baseline. The goal is not calm at all times, but the ability to downshift after activation. These four inputs, muscle contraction, fiber intake, sleep consistency, and nervous system regulation, work together. None of them needs to be optimized to be effective. They are additive, not competitive. Cardiovascular health is shaped by repeated signals, not dramatic interventions. Understanding the physiology allows you to choose changes that fit your current capacity. If you would like a structured reference that summarizes these mechanisms and offers practical starting points, you can download the free February Heart Health resource. It is designed to support informed, self-directed decisions. As always, use this information as data. Small, consistent input matters. Thanks for watching, and I'll see you on the next one.